What about anxiety? How often do you see anxiety causing shortness of breath?
A lot more than I thought I would when I first came out of school.
Is that right? So
Yes.
you see it frequently?
It's very frequent.
So people get short of breath and they come in and say, I don't know if something's wrong, but I'm short of breath.
Right.
How do you know it's anxiety, and what do you have to do for that person?
You really have to get a very good history, and really anxiety a lot of times is a diagnosis of exclusion. You know,
Okay,
you try to get a good history. Is it the heart? Is it the lungs? And if it doesn't have a typical presentation, then you think of other things.
Does the person present a certain way? For instance, somebody that's got a lot of anxiety, they take those deep sighing breaths.
Yes,
and they say,
a lot of times it's a shortness of breath that's not with exertion, it's not with activity, it comes on suddenly, there's no really rhyme or reason to it. A lot of times they can say it's when they're stressed or have a presentation at work or something like that.
how do you explain to that person that's got anxiety and they're short of breath, how do you explain to them that they're not going to die tomorrow?
It's really difficult. Now, some have an idea that that's what's going on, but other ones are convinced that they're dying or they have heart disease or lung disease, and it takes a little bit of good explanation to the patient.
So, and do you have to rule out those things?
Absolutely, sometimes you do.
What are some of the studies?
Well, depending on what you're considering, you do a chest x-ray to make sure the lungs are okay.
The chest x-ray, would that tell you anything about the heart?
It can tell you the size of the heart, if it's enlarged.
Chest x-ray?
I would probably do an oxygen level to see if they are short
of breath
or not.
Now, what's an oxygen level?
Well, in our office, we just put a monitor on the finger and it checks the saturation of the blood circulation. It's pretty easy to do.
If they've got saturated blood, that means there's oxygen on the blood.
Right.
That means the chances are
that there's
nothing going on right then if they're short of breath then.
Right.
How do you treat that patient?
Well, I think you have to try to convince them, first of all, to accept the diagnosis, to understand what it is, and then you give them different options. There's medications, there's therapy, there's the understanding that that's what it is, and sometimes they just need that self-assurance.